Hey guys, Dr. Ben here. I wanted to show you real quick an X-ray and what a normal X-ray should look like and what a typical X-ray looks like. So this person came in, and when they initially came in, you notice that they have a straight neck, where if you look at a normal X-ray, it should have this normal forward curve. That's the side view of the neck. So it should have a banana-shaped curve from the front. And then basically when we have that curve in our neck, it creates a shock absorber. So the weight of the head, about 8 or 10 pounds, is sitting on a shock absorber. And when we lose that curve, now we've lost the shock absorber. So you'll notice with this normal X-ray, when we do tummy time as a baby and we learn to crawl and walk, that's how we get those normal curves. And then we have an injury or a trauma or a fall, and then the curve goes from curved to basically straight up and down. And then another decade or so goes by and we start to get that forward head posture. And then eventually we start losing some of the disc spacing, and then the body begins to treat it like a broken bone. So that is the progression of degeneration, which usually starts years or decades before the pain ever shows up. So in this lady's X-ray, you notice straight neck, so loss of the normal curve, and we have a good, nice, healthy disc, good disc, good disc, good disc, and then we have a bad disc, not so good here either, and then this one's good. So right there is the problem between C5 and C6. And if you look at how this works, if you take a cross section of the vertebrae, something has to knock the vertebrae out of alignment. So a trauma or a car accident or a fall or repetitive strain, texting, staring at computers, but it moves the spine out of position. And then over time, we start to lose that spacing in between the vertebrae. And then eventually your body starts treating it like a broken bone. Now the nerves that exit from that part of the neck leave the neck and control the shoulders, arms, and all the way down to the fingertips. So we get a lot of people with like neck pain, shoulder pain, even numbness and tingling in their hands, but then they can also have a lot of issues with high blood pressure or irregular heartbeat or shortness of breath, because the same nerve that controls the arm and the hand is the same nerve that controls the heart and the lungs. So that's why when people have a heart attack, they'll feel the nerves in their neck and their shoulder. They'll get that jaw and shoulder pain when they're having a heart attack. Now, we don't treat heart attacks. That's not what we do here. Our job is to get the pressure off the nerve so the body can heal and repair the way it's designed. And then we show them rehab and stretches and exercises to reproduce that normal healthy curve in the neck with ligament stretching and strengthening to actually get to the underlying cause of the problem. So if you're interested, need more information, feel free to reach out.